The views and comments of the hosts and guests are not necessarily those of the station.
Hi, I'm Nicole Jacinto. Join us on Healthline with 𝗥𝗲𝗵𝗹 as we discuss the latest health and medical topics with doctors from 𝗥𝗲𝗵. For a healthier and uplifting lifestyle, tune into Healthline with 𝗥𝗲𝗵𝗹 on 𝗛𝗲𝗃 8:10 a.m. Radio Bandido TV. You've got questions, we've got answers.
Watch and listen to Healthline with 𝗥𝗲𝗵𝗹, Mondays, 5 p.m. to 6 p.m. Airing on Sky Cable Channel 224 and on all DTT boxes. Simulcasting online on Facebook and YouTube. Listen and watch on your mobile devices. Just search 𝗛𝗲𝗃 Radio Bandido.
You're about to experience Healthline, a show where doctors from 𝗥𝗲𝗵𝗹 interact with you for a healthy, uplifting lifestyle. Moderated by Nicole Jacinto. You've got questions, we've got answers. So welcome to Healthline.
Hi, everybody, and welcome to Healthline with 𝗥𝗲𝗵𝗹. I'm your host, Nicole Jacinto. It's that time of the week again, and it's that time of the day. It's time for Healthline with 𝗥𝗲𝗵𝗹. And today with us on the show, we have Dr. Mark Austin 𝗥𝗲𝗽. He's an emergency room doctor, emergency room specialist in 𝗥𝗲𝗵𝗹, of course. Hello, doctor. How are you today?
I'm good. Hi, Nicole. Nice to see you again.
Thank you, doctor.
Yeah.
It's good to see you. And today to everybody out there, we're going to talk about road traffic accidents. But before that, Dr. 𝗥𝗲𝗽 and I were having like a short discussion. He met my 4 children, the 3 Shih Tzus, the one Spitz, Japanese Spitz / Pomeranian. So yeah, they're just there showing their faces on camera, picking up the spirit from Dr. 𝗥𝗲𝗽. So okay. Anyway, folks, since today's topic is traffic road accidents, why don't we ask Dr. 𝗥𝗲𝗽, who is the perfect person to ask since you work in the ER, no, doctor?
Mm-hmm. Yeah.
What are the most common road traffic accidents that you see and that you know of, especially in the setting of Metro Manila or Makati or the Philippines in general?
So I've been practicing in urban areas like high population density urban areas like in Makati. Of course, there are a lot of traffic road accidents, especially now. We've been seeing increasing number. So it can be as minor as soft tissue injury, like contusions, or like some cyclists, or just having uneven, they pass by, or motorcyclists and passing by uneven roads, so they kind of like lost their balance, would fall off. As minor as that, and as major as head-on collision with another high-speed automobile.
Hey, doctor, you were saying that you see them more often now. Is that because of the Christmas season, or
Oh, definitely. It's Christmas season. Traffic is way more travel. For sure, all of our motorists would really feel how bad the traffic situation now, because everybody's like, going to Christmas parties, have some events, reunions, etc. But more so also because in this, Christmas season, people get to dine and drink more than the usual. And then, and of course, as in our language, we say pasaway. There's still a lot of pasaway drivers who will drink a bit. Di naman ako lasing, nakainom lang konti, and they get to drive, and right?
You're right.
Yeah.
That's no, I'm not drunk. I've just had a few drinks. I'm not drunk. I've just had a few drinks, like 3 bottles of scotch na pala.
Yeah.
All right.
And then we get to see them. But also, I guess after the pandemic, a lot of Filipinos shift to 2-wheel vehicles from our usual 4-wheel vehicles. So a lot of Filipinos, especially in urban cities, we get to see them riding motorcycles and bicycles. And maybe it's not just them, but maybe also the situation, the traffic situation in the metro, the road, and it's not as conducive for these two two-wheel
for
vehicles
safety
in
in
the
general, and for you're
yeah,
correct, doctor. I totally agree with you, and I'll be the one to say, like, the way the roads are done, the urban planning, and
right.
just repairs that are
Hmm.
not done on time or not done at the time you would expect. You get mixed messages, and sometimes you're passing by a road and shook, there's just this
Right.
big pothole there. And for two-wheeled vehicles like motorcycles and bicycles, sometimes if you're not used to driving it, as you said, a lot of
Hmm.
people did shift to motorcycles and maybe bicycles, also for deliveries and all that, because it became
Uh-huh.
more
Hmm.
more of a, well, a lot of people have food delivered more and items
Right.
delivered more because you don't want to go out and you got used to it.
Yeah.
And also, like, if you had happened to save up and you don't want to commute and be in the crowded,
Right.
spaces, um
Hmm.
with anyone who could give you anything from COVID to bad breath. I mean,
Yeah.
it's true, right? So,
True.
it's also not that safe for them, and a lot of people don't, they tend to want to go out right away, so they don't practice driving. Sometimes it really takes years of experience, and of course you have to really be careful. So even if
Correct.
someone's been driving for 30 years, if they go
Hmm.
around driving drunk, or there are things where, I mean, some of the accidents, doctor, you said, like, soft tissue, is that like when somebody, soft tissue injuries or contusions, which are buckles, right?
Right.
And
Pasa
buckles,
and bukol. Yeah.
Asa and bukol. Okay. So is that from someone who, like, fell off a motorcycle or a bike, perhaps?
Usually.
Or sometimes here we have, like, the battle of the motorcycles and the cars.
Exactly. Yeah, definitely. So it can be as minor as bukol and pasa. Now, usually it happens especially in two-wheeled vehicles. Now, lost their balance, fell off their vehicle, and but it can also happen in four-wheeled vehicles. For
Mm.
example, some of them would have, like, sudden brakes. The
Yes.
sudden brakes can also cause whiplash injury to the nape, no, or to the neck area.
Mhm.
We call it the cervical spine. No, so sometimes the sudden
Yes.
break, and it kind of like makes your neck go back
Yes.
as an effect. We were mentioning about two-wheel vehicles ago. I just also would want to know that we've also been noticing a lot, those scooters that is kind
Yes.
of like one of the in things in the metro.
Okay.
So a lot of them will also get into accident because there's not a lot of protection when they do it.
Mhm.
So you just have like a soft helmet or a bit of padding, but that's it.
Mhm.
They didn't protect the whole body when if they will have loss of balance. They
Mhm.
can easily have some soft tissue injuries. But
Mhm.
these are the minor ones, no?
Minor ones.
What we're
Okay.
more, yeah, these maybe like in patients would have 10 road traffic accidents. Among them, probably like 6 to 7 will just have soft tissue injury.
Mhm.
Different degrees of soft tissue injury. And then there are some who would also have like cuts and lacerations. Those would need some suturing or stitches. Some of them would just need some glue or specialized strips, no, like a sticker.
Mhm.
So we can close down some of the minor ones. But there can also be some of the life-threatening conditions. No, head injuries are common. Fractures we also see. But and what we want to make sure of, and the whole discussion is to prevent those
Ex-
patients who would die,
yeah.
unfortunately, from this road traffic accidents.
Exactly, doctor. And also, okay, so I guess we can talk about some of the more serious injuries after. But as you said,
Mhm.
the whole discussion is geared towards preventing not just injuries, but, I mean, dying from actual injuries
Correct.
that happen when you get into accidents. And so I guess the more we can flesh out some more serious conditions aside from
Mhm.
broken bones and head injuries. And I mean, we can get into it if you'd like to use examples later on. But
Mhm.
how can what, let's say an accident happened now.
Mhm.
If you see it's road traffic accident, whether it's a motorcycle or a car or both, or a bicycle, or
Mhm.
people who bang into each other walking. I've
Other,
seen
yeah.
it. That's not really a road
Yeah,
traffic
definitely.
injury, but I've seen it happen. What immediate steps should, like, the drivers or passengers, whether or not
Mhm.
they've been hurt, and, like, I
Right.
mean, you're sitting in a car and one of the passengers got hurt, or a bus,
Mhm.
and you saw someone fly from across the back all the way to the
Mhm.
front. Yes, that happened to
Mhm.
me. And, or you see something happen. So these are like, what should you do right after the crash or the
Right.
collision or the sudden stop, if you're able? I guess, how should you check yourself and those around you?
Right.
Sense
So
of
the
mind.
first things first. Now, DOH, I think earlier this year said there are at least 12,000 killed in road traffic accidents this year in the Philippines. So that's a big number. So definitely immediate steps on what to do after a crash. They're very important for all of our televiewers, or all who listens to us. And this is something we want to share to the public. Number one, make sure your safety. Now, you should think first of yourself, okay, before you can actually help somebody else. Make sure that you're okay. So the first one is to check the scene. Is the scene
Mhm.
safe? Do we need to go somewhere else? To make sure that if you want to do some help to the other people, that the safe. So if you can ensure the safetyness or the safety of the environment, then you can stay. But if you don't, move to a safe location if possible. You can turn on, if you're in the car, turn on hazard lights to avoid further accidents. Or some of them would have some reflector. Put it on the road so that the other motorists would prevent from going to that area. Then after making sure that the scene is safe, then you check for your injuries. Now, assess yourself, and others involved for injuries. The first, if you're okay, then you can check for other people. The usual first step that we do is to just ask your name, or how are you? How are you? If the patient is able to,
Speed. Yeah.
verbalize whatever that person is feeling, that means the airway, the breathing is okay, right? That is something that So sometimes, like, some of our patients would ask us, like, why do we still have to do this? It's actually one of our check.
Yes.
So, and then next, call emergency services. So 911 or any of our emergency services that we can use. Some local government units would have some other numbers. So if there are injuries or significant damage, call immediately for help. Okay. And last, if you'll be able to do so, and if you're trained, then you can provide first aid. So administer basic first aid to those in need, prioritizing life-threatening injuries.
So let me just recap and touch on a few points that you said, and of course, jump in, correct me if I'm wrong, remind me of anything I forgot.
All right.
Oh, okay. So when you say assess the scene first, if it's safe, I'll give some examples that are
Right.
Perhaps we've seen it on TV and we think it's extreme, but it does happen.
Right.
Well, one could be as simple as, if there was a crash and there's glass all over, that may not be a safe place for you to walk on if you're a passerby, or someone who wants to help. And then, of course, those, we've seen dramatic scenes where there's fire, of course, and cars turned over, and scary stuff like that. But I've actually, some of us have seen it on the road, on the scene.
Right.
You notice people starting to pile up and wanting to look, but you're like, you just better get away from here, because all these vehicles have gasoline, and you're going to add to the problem. There's fuel in it. And before you can help someone, make sure that the area is safe, or perhaps if part of the vehicle or somebody flew into and is submerged into water, like the river, so those are that, I mean, maybe so that people understand better. That's what Dr. 𝗛𝗲𝗹𝗁 means by make sure the environment is safe also before all of you jump in. And then you mentioned reflectors and all of that as one way to help to stop other people from piling on. Because sometimes you won't see, you can't see the accident, especially at night. And you've seen, I've seen how people help each other out, and they'll park like before cops even arrive. They'll park front and forward, and they'll help like traffic and start letting people no, there's an accident here, and then the others try helping also. So those are just a couple of things. And then you mentioned, so you for after checking yourself to see if you've been affected, like maybe you don't know there's a piece of glass on you, you got scratched, or maybe you got whiplashed.
Mhm.
because your seatbelt wasn't on, or maybe you have a seatbelt burn and it hurts your, I mean,
Yeah.
not burn, but sometimes it's
Yeah.
hurts your chest. Then you can check out other people and you ask them to say, how are you? And a lot of people will ask, why do you keep asking us the same questions? Well, that's because first of all, when someone speaks, that's their you can tell that their airway, they can breathe. And if
Mhm.
somebody perhaps uses sign language or something, doctor, then they're
Mhm.
still conscious, right? And that they can
Mhm.
maybe listen to their breathing. Then you said to, of course, apply first aid. Now, what can you give us some examples of when it comes to first aid and training? Can you give us
Mhm.
some examples of what the general public can do? Do you have to be very qualified? Do you have to study it? Do you have to be,
No.
yeah, okay.
Actually, that's what we've been pushing in the college also, the Philippine College of Emergency Medicine. We're pushing that all Filipinos, as in any other country more developed, would have some knowledge of basic life support. So the first aid corresponds to basic life support, right? And
Mhm.
this is something that all Filipinos should know. It can actually help, prevent death in general in any scenario. So usually we start with a primary survey. We do an ABCDE approach. So airway, breathing, circulation means heart rate, no, checking the pulse, and then checking for any disability or exposure.
Mhm.
I agree. It might be in Filipinos or in those listeners who are not familiar with this approach. It might be can be foreign for them. But as basic as checking how they are, checking for the pulse, which
Mhm.
I think a few discussions went. We already
Yes.
actually had that kind of discussion on how to check the pulse.
So you can do it
Um,
here in the neck or here in
yeah,
the
and
wrist.
yeah,
Yeah.
wrist, no, or in pediatric or in children, you can check on the biceps or in the
Yes.
arm. Check for the pulse.
Here.
If it's a
Here.
strong, steady pulse, then you're okay. So
Okay.
now already know that the patient is breathing when they answer us. We know that they're conscious, so meaning their brain is working, and then we
Mhm.
check for the pulse, meaning the heart is working. And now we look at the disability. We check for any signs of bleeding. Is there anything that is bleeding massively?
Mhm.
So if there is, then we can start with putting a tourniquet. Of course, there the nitty gritty of how to use a tourniquet. We may not be able to explain such in
Yeah.
this scenario, but suffice to say, if you'll be able to stop the bleeding, then please do so. Apply direct pressure,
Direct pressure. Yes.
or putting a direct pressure on the area it's bleeding, or tourniquet.
Okay.
If you're able to move the patient, so again, it's a case-to-case scenario, how bad the injuries are. There are some patients who have some fracture on the leg, so it's kind of difficult to move them.
Yes.
It's very painful. For sure, they'll be shouting
Yes.
when you move them, right? And in some cases, moving them will actually cause more injury, more
Yes.
harm than we'd want it to be. So if in that case, if you think you cannot move the patient anymore, as long as the scene is safe, that's a priority. The scene is safe. No?
Yes.
As long as the scene is safe and you cannot move the patient, calling for help is the next important thing. And I think that is one of the things Filipinos, or in general, people would forget, is to call for help. So these are the first aid, if you may, in a road traffic accident, especially for bystanders and first
Yes.
responders. Agree with you. One of the things that the bystanders and first responders would do, aside from extricating or getting the patient out of the vehicle, is to direct traffic. That is the most helpful that people can do, because it can also give chance for responders, like
Mhm.
ambulances, to go directly to the scenario and assess the severity of the accident. So meaning that is one of the things that we can do in general. No, in some patients, actually getting pictures of the scenario can also help doctors in the ED of what
Yeah.
exactly happened. So we can picture out what can possible scenario, what can other injuries be happening to the patient. No, so and then of course we do other tests. No, especially for an emergency team or the basic responders, first responders. We do assessment of the consciousness. We call it the Glasgow Coma Scale. Now we check for how how responsive, how conscious the patients are. Then we get to triage them on who will be needing the most urgent care or most emergent care, and those who can, wait for a bit and then assess them afterwards. And then, look for external injuries, take photos of those injuries, obvious fractures, bleeding wounds, and so that we can assess on them properly at the end.
And some of those photos, doctor, I mean, don't take it just to, like upload it and then be like,
No.
an accident. Take it and give it to the patient and the doctor.
Correct.
So that they can assess the injuries and even the way the cars were or what the motorcycles were at the scene. And perhaps the police will need them too for the police report or insurance, whatever it is. Because a lot of people.
So I, of course, we want to put a word of caution to those people taking photos of those scenes. These can be of medical legal nature. So taking photos, it is of course of coming from a non-malicious intent.
Yes, exactly.
This is something that we want to help the patient out, for the doctors to be able to help the patient out, or for police enforcers to be able to legally help people involved in the scenario. Taking photos and sharing it on social media, for example, is violation somewhat of patient's confidentiality, especially for those who would not want this accident to be aired in a public setting. It is already unfortunate that it happened, so putting additional salt to the injury of putting them out in social media without their consent is way worse, because it has long-term repercussions.
And it does. And I'm part of the press, and the press is also like, before they used to sensationalize too many things. Accidents, just taking pictures without permission. It's really not necessary to put all these, horrific pictures out there and treat patients like pieces of meat. Yes, I have gotten arguments with the press about that. So so being a bystander and putting it on social media, you're tantamount to that. If you don't have good intentions, basically, or you're just doing it because you think you think your friends will enjoy it, really. Okay. Anyway, doctor, also you did mention okay, if you can move you said the basic priority. I'll just go back to one thing you said. The basic priority is that the scene is safe. So if the scene is safe and you know that help is coming, and there's no immediate, let's say somebody broke their leg. Okay.
Right.
But you're not a doctor, or you're not sure how to move them, and it's difficult to move them. And we told this, or someone says, I can't really move, or my back, do you find that it is a common mistake? And what other common mistake do you find that people will move the patient and force them?
Correct.
Get up, or, try to do this, or just pull them. And, when can that be a bad thing?
So again, it really depends on how the accident happened. The worst case that will happen by forcing someone to get out of the vehicle without really assessing how bad the injuries are, they can actually have some form of neck fracture. Neck fracture is very, very serious condition. Whereas in those accidents, getting them out of the car without proper collar or without any protection can actually cause either loss of motor and sensory, or they'll be handicapped. Paralyzed from the neck down. But even then, like in areas where it controls breathing, or the muscles of breathing, called the diaphragm, if it happens that the injury is on that area, they can actually kill the patient, right? When in fact you're just trying to help. So again, if you're not sure of the injuries, especially if something rolling over, and the scene is safe already, you establish that the scene is safe, then making sure that somebody else would know how to extricate or remove the patient out of the car will be better than you pulling out the patient out of it. But then again, the priority is the scene should be safe.
Of course, yes. It's just
and also,
Sorry, go ahead.
Also, so aside from the neck, there's another fractures that people will usually not think of because it will not be bleeding externally, so you don't see a lot of blood. But hip fracture can actually cause a lot of internal bleeding, so much so that the body or the person would lose a lot of blood out of the circulation and goes to that area because of the fracture inside the hip. And you can actually make the patient lose a lot of blood and die eventually if it will not be assessed properly. So those two things, neck fracture or hip fracture, one of the two of those conditions that are actually removing them out of the car make them worse.
Yes, thank you, doctor. Just to be a little bit more to get to flesh that issue out, because
Right.
sometimes or somebody will fall and then people will forcibly try to move them, but you don't know how. You don't have the stretcher there with a stabilizer for the neck or other things. You're not trained professional, and it's not necessary. But as you said, of course, securing the scene is a priority, and otherwise it'll be one of those things where it'll be one of those moments where it's kind of like watching a funny movie where somebody gets stabbed and you pull the knife out and then the blood comes in. Oh, sorry, and you stick it back in. Like you don't want that to happen where you're like, I don't know what to do, because
Exactly.
I think as a culture where I have seen people try to get people up, or maybe give them water right away, and because they're puking. But at least I don't know why I'm always exposed to this stuff. But anyway, at least means like, no, don't do that.
Yeah. Right.
Okay. So
Or maybe that's the reason why you're moderating this session, I guess, because you're always exposed to this stuff. Then you have more knowledge, more experience
the
regarding it.
patient bringer, I'm also the patient bringer. And then as
I want to go back to that, exactly your point. And one of the most common mistakes of people involved in such accident is them panicking. How we react to the scenario actually contributes on how well or how bad the outcomes would be. And panicking can just lead to poor decision making. So it's very vital for everyone to stay calm and follow procedures. If you don't know what will be the procedures, or you don't have any idea how to do it, then second step is to call for help. Very important to also call for help. Someone who will be more knowledgeable on what to do can actually make you, can actually make help or can help the patient later on.
Okay, thank you.
So and we've seen a lot of these patients in the ER that they're also fine. I mean, we cannot, as a clinician, I cannot discount the fact that of course there's anxiety, there's stress after, there's trauma after an accident, and it's completely expected of them. But if we can stay calm, if we can find that kind of certain time that we can stay calm. If you don't know how long you can stay calm, call for help. Get someone else to stay calm for you. Because all we want to do is to make everyone safe at the end of the day.
I thank you, doctor, for saying that. To informing and educating us and educating everybody out there. I mean, I have a switch in me that's personal. Not everybody has this. I have a switch in me that just goes on when there are a lot of emergencies, let's call them, and I am very stressed out inside, but I kind of, we'll do this, we'll do that, sort of follow procedure. But there are some people, or maybe I have been in this position where you just can't take it and you get hysterical, and it's because of your concern, or you're also injured, and you're kind of melting down with anxiety. So as you said, call for help. Help. And if you're all alone in the woods, remember all of the movies that you watched. Remember the words of Dr. Mark Gawaran. Okay. Remember all the movies you watched.
So you have to call for help.
Do not run upstairs. The killer is always someone you know. Okay, those are not road
Exactly.
traffic injuries anymore. Okay, so doctor, when it comes to getting to the ER and the teamwork
Mhm.
that comes in, okay, first you did mention triage earlier. So the first thing that
Right.
happens in the ER, let's talk about what happens there in the ER after a road accident. When you get to the ER, can you just briefly go through triage
Yeah.
for the audience
For
and then
everyone. Actually,
yeah.
even before, and most of the cases, especially in Makati area, which the LGU has a good way to communicate with other hospitals now. To be fair with the LGU, we get calls from the central command unit talking about a patient to be sent to the ER. From a road traffic accident. No? It can be the nearest hospital. It can be because of, but usually it's because of the nearest hospital because we really would want to make sure that the patient is safe. We want to
Yes.
put them in the nearest hospital. So even before you guys or any patient will come to the ER, especially in Makati area, once you pick up by the first responders, they call the nearest hospital. And sometimes we get called because of it. So
Yes.
we get the call, we get the name of the patient, the vital signs, and then even before you guys come, we get to know as emergency physician to classify then how bad or how bad the situation would be, how many patients will be arriving. Is it just a single casualty patient in an accident or multiple casualty? So we get to be prepared before you guys come in. So and then once you come in, you'll be triaged, no, depending the severity. The vital signs and the consciousness are very important. We call it the GCS scale or the Glasgow Coma scale, no. And then we check if this one needs emergent, meaning right away attention from the whole team, or is it something that can wait for a bit, assess first, and then check on later on? Can do diagnostics like X-rays or whatever, and then assess how bad the scenario would be. So even then, that's the whole process of selecting patients depending on severity and which one would benefit the most immediate care, medical attention is what we call triaging. Different hospitals have some different triage processes. Ours, we use a ESI, we call it Emergency Severity Index triaging. One being like the most like needing attention right away, like those who would be in life-threatening conditions or limb-threatening conditions, means you have to get out. You have to get them. So they bypass the whole triage process. The nurse at the
Yes.
we call it the scan triage nurse, scanning all the patients. You bypass the whole process of taking the vital signs, you put them in the critical area of the hospital, and then we do the resuscitation. And those who would be needing the least, or the least medical attention right away, we call it ESI 5. Then they can wait for a bit now. But usually road traffic accidents will either classify from ESI 1, meaning the most immediate, to ESI 2, which means we have to see them in a few minutes, usually 30 minutes to 60 minutes, that they wouldn't be having any problem. In an area where there will be a mass casualty, like, bus and a bus collision, for example, in that scenario where there's a head-on collision, kind of like high intensity, high speed collision, a bus. At that point, we have to check. We have to check right away. We have to do a quick triaging of all patients involved. Those, like, usually the usual scenario would be we ask the whole casual, like the whole people who is in pain.
Yes.
And then if they raise their hand, they're conscious, they know what you're saying, they respond to what you're saying, and then you ask them to move to this side, to one side, wherever that is. If they're able to ambulate, then these people will be, I know they're in pain, but these people can actually, benefit in later time. We can prioritize other people. Those would say they're in pain, but they cannot move. Then that means there's some disability already on the extremities, right? So them, they prioritize a little more, right? Those who can say anything, then we check who are these people who can respond at all. Those who are unconscious, no pulse, then there's no point in way past it, right? If they're dead already, dead at the scene, probably way past it, especially in a limited number of doctors and patient and healthcare team members. We have to prioritize those who would benefit us. So that's how we do a quick triage at the scenario. But in the EAD, we able to triage them more, in depth. And so we get to give them the proper medical attention. So in fact, once you go to the ED, especially in a very critical condition patients, it is a bad thing. But to be honest, personally, this is where I see, especially in a very good ED team, emergency department team, that's when you don't even have to say anything. It's like an orchestra where people would be in their toes, you know what their roles are, and will be in sync despite you not saying a lot. Of course, communication is very, very, especially in triage teams or in ED, communication and communicating effectively to update, patients and to say what you're going to do or what will be your orders are and respond to those orders are very, very important. But then you get to see, I think there's some beauty in how good emergency teams respond to critical patients coming from a road traffic accidents. In Makati Medical Center, we call trauma response team. So it's not just the ED. We do assessment with all the ED team, but we also know how to call help. So it means that if that patient will benefit for or for straight away surgical procedure, we have to call the anesthesiologist, the trauma surgeon. We have to do, to call everybody, the orthopedic surgeon, if they are needed, depending on the category of how bad the patient is or how bad the trauma would be. So we categorize them even further, and then we call response teams to immediately assess the patient by everybody, because as you can imagine, any trauma condition is not just one specialty condition. It has the patient will benefit the most if everybody else will be right there away, assess them properly, and will approach it in a multidisciplinary approach, not just from the doctors, but also from the nurses, from the radiologists, from rad techs to med techs, etc. Because again, depending on the case, then this can be the possible scenarios in the emergency room.
Okay, thank you, doctor. So as you said, there's even further triaging or prioritizing, like you guys are on it all the time. If it's a multi-car accident, but from one accident, if there are different accidents that are happening at the same time, you even before the patient gets there, you get calls, or either from the LGUs or someone is calling to say they're coming in.
Or a different ambulance company, a private ambulance company can also call.
Companies will say, okay, we're taking the patient there because it's nearby, or this is where the patient requested, or, we think you have the right equipment, right? Because this is kind of, I don't think this can be handled by the very nearest medical center. And when they arrive, of course, there are people who go to the ER on their own. And, that's why sometimes you just see people wheeled in and you're like, they're complaining. Why did they go ahead? Because they're unconscious, and they came from an accident, and you have to deal with those people first. So unfortunately,
the emergency department in any country, in any hospital, it's not a first case first, first served basis. It's not a restaurant where, So that's a whole point. We'd want to educate also the public on the triaging process. So sometimes you've waited a bit longer than the other person, but imagine if you're being asked to wait a bit more, that means you're actually fortunate to be asked to wait a bit more in the emergency department. If you get to see people like just flashing through your eyes, get out of the bypassing whatever you did, it's because unfortunately these people will actually die if you don't do anything about it right away.
And you were saying earlier also that everyone in an accident, it gets prioritized because there's also, I guess I'm guessing from the part on what and the things that you said is that, okay, if people can move or they're mobile, but that's on the scene. But I guess in the hospital as well, you start interviewing people. I don't know if you can spare the help, if there's one nurse assigned to just this accident. One saying a triage nurse, like okay, drop what you're doing first and take care of this. And there are people who they're okay, but you do check them out when they come from an accident where there's trauma, meaning like injury or some big bang kind of event, because they may be okay now, but if you didn't take all of their, like you didn't do an X-ray and check all these things, you didn't. Oh, this person has internal bleeding. It's not, the person isn't bleeding out yet, but they might suddenly faint later. It doesn't mean they're A-okay already. So if you have been in an accident and you're part of the group that's been taken to the hospital, I guess I want to like remind people out there, like when the doctor or the others are not looking and they said, okay, wait your turn, then we'll check you out. Don't sneak off.
Yeah, definitely.
I was actually outside your hospital a few weeks ago at night. I was making someone bantay in the hospital, and out of your ER, somebody said, they're taking so long. Outside your ER, I'm gonna leave na. And her friends were trying to convince her. I don't know her name, so Lord, I don't know. I just hear these things. And she was like, no, I wanna go na. But they said, yeah, but you got into an accident. I was like, you just better wait. I just interrupted the conversation and said, you just better wait because, what if you have internal bleeding? Then she freaked out. It's like, okay, bye. I didn't scare you, but her friends were really like, and so there, better wait. I mean, sometimes people just sneak off, and it's not a good thing.
And sometimes it actually is. Some of these patients, we actually ask them to wait only because we observe them while they're injured. So sometimes some injuries are not too apparent right away, and we have to be careful about that too. Like minor ones that not bleeding initially, but actually would bleed later on. So we do actually check them again after a bit of time while we're observing them in the ED. Agree with you. The resources in any area is very limited, right? It's a finite resource. Now we can only have a bit of nurse, but we also have surge capacity. Like if there's like a big number of patients, we also know we have some way to increase the resources that we have. That's why it's very exactly. So calling other people, other emergency specialists, other nurses, etc. So that's the reason why, especially in mass casualty, it's very important for us to be able to be coordinated with, in terms of transportation from the ambulances or from the scene, because that will help us prepare for any kind of surge. We get to see the surge, so that's very important too. So we get to establish some form of command center if there's like mass casualty, so we can discuss about management regarding prioritization. Then we reinforce the triage, which one would have, we call it the START, the simple triaging and rapid treatment method is usually commonly used, in any tertiary hospital in the country. And then, of course, again, we do effective communication coordination with everybody involved, including those who are responding at the scene. So we know how many patients are still expecting. So these ones are being taken care of. This like all these scenarios will be simultaneously, ongoing. And then, of course, there's also fluidity of action. Just not because you're a doctor, you cannot do, IV insertion for, if there's a need for us to do. So team members, must support each other in real time, adjusting quickly as the conditions change. But of course, there's also some challenges that we get to see. Now, for example, some challenges we get to see are from pediatric patients, right? Children are actually they're the most affected with road traffic accidents. Death among 5 to 14 years old are higher in road traffic accidents. So we have to consider, anatomical body changes. Like different ages will have different.
Let's talk about that, doctor, and then perhaps the early after. So pediatric. Okay, so you said death in children. What age was that? 5 to 12 years old?
5 to 14.
5 to 14.
Involved in road traffic accidents are higher than that of elderly. Well, number one, a lot of pediatric patients, the challenge is they cannot verbalize. Everything's in pain, but it's difficult for them, especially the younger ones, to verbalize what exactly, what exactly affecting their body, what's hurting them, right? And also, it's easy for them to deteriorate. No, imagine they have less blood, for example, blood volume, and of course, their organs are smaller. Their bones are a bit softer. Not all of them would have developed bones. Bones supposedly would protect internal organs from crushing injury, from these kind of injuries. But if we have soft ones, then it's easier for them. So the small size of pediatric patients make them more vulnerable with road traffic accident
Here's the
injuries.
anatomical things you're talking about, anatomical
Yeah.
structure of pediatric patients, and the bones
Patients, yeah,
are soft, and they are growing, right? So,
yeah.
yeah.
So these kind of things need to be considered. No, aside from the fact that everything needs to be calculated, pediatric patients, when you're an adult, you just give a certain number of medications in a particular dose. Unless they have certain conditions, then in general you'll be okay. But in pediatric patients, it really depends on the weight, etc. Of these patients, the age, the height. And these are the things that you have to consider. And in a quick response, it's not always easy to complete all these things, because giving them a underdose or an overdose can actually be more harmful for them. So, it has to have age appropriate care, and physiological and anatomical responses are different for children. And this is also true for elderly, a lot of
Should you
patients.
call in like pediatric nurses sometimes for help? And for example,
Yeah.
if the child or the pediatric patient is not even that communicative because they're shy, or they're
Right.
they're stunned, they're not sure.
Mhm.
Maybe they were with one of their parents or their primary caregiver, but the parent is knocked out. And usually it's mommy who will say, my kid is allergic to this, is allergic to that. Don't give my kid
Exactly.
this, So they're looking for that voice, like their voice.
Correct.
Okay. All right. So you do call in
So-
help. No?
Yes, in Makati Medical Center, we also have. We're very lucky to have pediatric emergency specialists. No, so aside from pediatricians, they subspecialize in emergency medicine. So it's kind of like more specialized kind of training, and we're lucky to have them in the section of pediatric emergency in the Department of Emergency Medicine of Makati Med. So again, even for the nurses, you can ask for help from pediatric nurses also to respond to such scenario. And it's also true for elderly, extremes of
the
age.
elderly,
Pediatric patients are also vulnerable to increased morbidity and mortality. They have more complications in road traffic accidents. Number one, majority of our elderly, if not, would have some form of other comorbidities, some other diseases. They have diabetes, they have hypertension. Some of them would have liver or kidney diseases, and that could complicate treatment. Also, fracture is worse or would increase in patients or more older in general, because age-related bone fragility can lead to higher rates of serious fractures from accidents. And of course, they're also taking medications for their comorbidities now. So we should also take care of these things. So there can be drug-drug interactions, or it can interfere with the treatment. Now, some of them will also be taking antiplatelets or something that they can,
like if your cholesterol is high or your blood pressure is high, somebody may give you a kind of blood thinner.
Blood thinners, yes, exactly.
Aspirin, that's already a blood thinner, and you'll bleed out faster.
Exactly. Right. And even like a non-serious head injury, which in any other patient will, be okay. But if you're taking blood thinners and you have tendency to bleed, then of course we have to do other things as well. So these are like considerations for both pediatric and elderly patients. And of course, there are also some elderly who would have some form of dementia or Alzheimer's. So they cannot communicate also the way children can, the same thing as with children. They cannot communicate as much what happened, what transpired, or how they're exactly feeling, So this can be hindrance to a more, better outcomes for them.
Doctor, when it comes to the elderly, can I ask you something that's not exactly medical, but may require some of your, understanding of our culture and also things you've observed, do you find that when it comes to the elderly and being involved in accidents, they are also less expressive in terms
Yes.
of how they're feeling, what
Yes.
and they
Yes.
tend to, in a sense, lose their voice or it's diminished, whether or
Correct.
not they have dementia or anything else.
Actually,
Mhm.
definitely, Nicole. Like some of our elderly, especially if they feel like they would be in a way,
I don't want to
be
be a bother. I don't want to be a burden.
burden. They always feel like they're a burden to their children. So sometimes I talk to them personally. To be honest, if you'll be taken care of, the mere fact that you're here, that your children actually are still as worried as you are. So they will be more burdened if they feel like they didn't do anything and we should have done something for you. And then you said that you don't want to do it, then um, everybody will just not be having a good night's sleep, including me as a physician.
See, so
Seriously.
you're one of those good doctors. Do you also find, because there's another side also where there are some people, if they've not been in the situation where it's their parents or some people that they care about dearly, or they're not a doctor like you who has it's just, do you find that they're dismissive of the elderly, like, oh yeah,
Um,
well, that in a sense, like, like they'll say, can you walk well or nakakalakad ka ba ng maayos? May ano na kasi ako, di sige dyan ka muna, but yung pala it's an injury. And just in general, I mean, maybe you don't have to answer that fully, but this, I'm concerned about how, this plays in.
Definitely. I mean, it's a case to case basis. I've seen different relationship among like elderly and their children, or even their caregivers, right? So that is something I won't be able to wade in. But as a clinician, what is imperative of me is to make sure, even if the patient would not want to give the whole data, to be able to assess them properly and give them the proper treatment, whether or not they want to push it. Of course, in bioethics, patient's autonomy would still be the priority. But as a clinician, it is our responsibility to be able to talk to them, to walk through them, and give them the options of their management.
So you do explain well. You're the kind of physician who takes the time, as you said, and you tell also the elderly person, no, you're not being a burden, because if your children are worried about you or whoever it is that you're with that's younger than you, you're not being a burden. And if there's something there that you or your team didn't check out, then it will be more of a burden to the children and to you, that you won't be able to sleep.
Yeah, exactly.
Instead of putting it, because a lot of the elderly feel like they're burdens.
Right.
We're all
especially in our culture. Especially in our culture now, because now a lot of Filipinos are very fast paced. Our lives are now more fast paced than the usual. So they feel like there's work the next day, or work a shift later on that day. So they feel like they don't want to ask of them. But to be honest, like if we'll get straight to it, actually it will be less of a burden if we know right away and we manage them properly, as immediate as we can. And you get, do the things that you have to do, your activities of daily living as soon as you can do.
There are many dynamics that go into a relationship, and sometimes you can have conflict, but still, there. It's one of the. I don't wanna.
Maybe it's a discussion for another day.
It is an advocacy of mine, okay? I care about
it's a discussion for another day. Yeah.
That's right, Doc. It's discussion for another time. Is there anything else you'd like to?
Last, if there's anything before we get into a road traffic accident, Nicole, what I'd want to emphasize at the end of this very fruitful is the action prevention is always better than the cure. I always say to my patients jokingly, I hope I do not see you again in the emergency department. I hope to see you somewhere else, but not in the emergency department, not if I'm working, as much as we can, right?
So I hope please, to see you at a Christmas party, but not here.
Yeah, somewhere else. Maybe in a dinner or whatever, but not in the emergency department. That's the worst possible place to get to see me. Because I know that means, something's up, right? So I would want to Also tell this communicate it properly to our listeners that how we can protect ourselves from getting into a road traffic accident. So for our cyclists and motorcyclists, especially now we're getting more of them, please wear protective gear: helmets, gloves, padded jackets, long pants, sturdy shoes. If some of our Filipinos, they always say that the helmet, the good ones, are very expensive, but health is
Your
more
head is more
expensive. Hospital bills are way more expensive, right?
Doctor, so I'm gonna have to make a comment there. I've seen a lot of people using motorcycles, and coming into like the subdivision where I live, and then they'll deliver stuff at the gate, and they're wearing chinelas and shorts and camiseta and no helmet, and I just cannot help myself. I'm like, aren't you afraid that you're gonna get, just be careful? And they're like, dyan lang naman. Yeah, and most accidents just takes one
Or dyan
moment.
lang naman.
Yeah. Yeah, and like you said, mahal eh. Oh, mas mahal yung ulo mo.
Yeah, right. And yeah, please use visibility aids, especially if you're doing it at nighttime. Bright reflective clothing, gear that increases visibility to other. And then, of course, maintenance of the vehicles, cars, and any of those. Regular checks, service them, to ensure that they are safe and functional. And practice defensive riding, the defensive driving, stay alert for potential hazards. Sometimes how safe we think we do the driving. It just takes one another person who is like drunk and crazy to actually have an accident with.
One other person panicked and stepped on the wrong pedal. One other thing.
Right. So please protect yourself at all costs. Obey traffic rules. The rules are there to actually make the road safer for everyone. So please reduce, follow speed limits, use signals and lane markings to reduce accidents. Use mirrors and lights. Always stay sober. Please do not drink and drive. There's other ways to use a hailing app to drive you, or ask someone else to drive you when you're already intoxicated. It doesn't matter how many beers or shots you've taken. Konti lang naman nakainom lang but not laseng, but sometimes also lessen or slows down your
your reaction time, right?
Yeah. Your reaction reflex, and then and take safety courses, plan your routes, and avoid distractions.
Personal note here to add to what you're saying, Doctor. I have lost friends and relatives to road accidents because they were drunk or other people were drunk, and it's not just alcohol, also whatever, any kind of drug you're on, intoxicated, or if you're sleepy or you took allergy medicine. The thing is, if you guys drank too much, just stay over. If you're afraid of COVID, spray their Lysol. I mean, find a way, explain. It's worse to hear, and the kids who break. Okay, as an expert former drinker, and I mean, like, I could have been in the Olympics of drinking. It's just, don't risk it.
Right.
Want to live for
it's very unfortunate.
Yeah. I mean, don't risk it,
A lot of young, capable individuals die needlessly at all because of road traffic accidents. These
and you're involving other people also.
Exactly.
I mean, you could kill other people. If you don't die, you can kill other people. So I guess I sense we're both passionate about this. We'll talk about it another time.
But always nice to see you, Nicole, and discuss these things. And I hope we were able to share a lot of practical advice and practical tips for our viewers too. So hopefully there will be less road traffic accident this Christmas season. And I hope everybody gets to enjoy the holidays without thinking of somebody else in the hospital.
Yeah. With you, Doctor, it's always a jam-packed discussion. It's always informative. Please do come on the air again. Join us. There's so many things to talk about because you see everything in the emergency room.
Right.
Okay, so thank you so much, Doctor.
Thank you
for being on the show today. I look forward to talking to you again, whether it's on the air or off the air. Thanks for tuning in, folks. You were just listening. You're still listening. Oh, you were just listening. Okay, whatever. Past tense, present tense, and future tense. If you keep clicking on the link, you're listening to Dr. Mark Austin Gawaran. He's an emergency room specialist. And I'm your host, Nicole Jacinto, for the show Healthline with Makati Med. See you again next week. Bye!
Bye-bye.
Thank you for tuning in to Healthline with expert doctors from Makati Med, giving you the chance to interact, uplifting your lifestyle. Moderated by Nicole Jacinto. Tune in again next week for your weekly dose of Healthline.
The views and comments of the hosts and guests are not necessarily those of the station.